I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist in Santa Fe, New Mexico, and recently I made a video talking about how long it should take to get a mammogram ordered or get another mammogram if you get called back, or an ultrasound and get a biopsy so you know whether or not you have breast cancer, especially if you have a lump like this one. A lot of people responded to that video and said that it took them months to get back in with their PCP or OBGYN to order a mammogram. And even after that mammogram was ordered, it took more than a month between that first set of imaging and the actual biopsy. So this is a PSA for all women and people with breasts in New Mexico. If you feel a lump like this, come see me in Santa Fe. I will order your mammogram or your ultrasound, and I will make sure that your biopsy happens in a timely manner. Here in New Mexico, all of our imaging groups are great and get patients in right away, but sometimes the rate limiting step is finding a PCP if yours has left the state, or an OBGYN that can order that mammogram. So if you're in that circumstance and you feel something, come see me in Santa Fe. I'll take care of you. For those of you who are not in New Mexico, a good way to expedite your care is to see a surgeon, because oftentimes surgeons have good relationships with radiologists and can call them if you're someone they're worried about, like this patient right here. Surgeons can also coordinate things so that way your biopsy happens a little bit sooner. New Mexico, but also in my prior practice in Texas, I have called radiologists for a patient that I was really worried about and been able to get a biopsy the same day or the next day. Now, I've talked about this before in my prior videos. If you need an MRI or an MRI guided biopsy, that usually is not something that can happen the next day, and usually at a minimum is going to take a week to get scheduled. But having a relationship with a surgeon will make the next steps easier. Something like this gets diagnosed, this is another breast cancer, and you actually do end up needing surgery.